Welcome, everyone, and thank you for joining us today. Before we dive in, just a quick note on housekeeping. Today's session is being recorded, and we encourage you to drop your questions or comments into the chat box. We will address them after the session. This webinar is part of our Ethical AI in Healthcare series, where we explore how organizations can adopt AI responsibly. Today's session, it's part 2 of a series that focuses on one of the most pressing issues, which is data security and governance concerns. I'm excited to be joined by our speaker, Ekta Jain Kaushal, Director of Risk and Compliance at our parent company, GEBS Healthcare Solutions, who brings more than 19 years of experience guiding large health systems on safeguarding sensitive health data in complex environments. And also with us is Guillermo Valdez. He is the data science manager here at CCD Health. Guillermo leads teams building AI solutions that improve patient outcomes while upholding the highest standards of privacy, security, and ethical governance. Guillermo and Ekta, thank you for being here with us today. Let's start by grounding us in why data security is so critical as AI adoption accelerates in healthcare. Guillermo, over to you.
Yeah, of course. So this is a relatively simple question. Why does it matter? Well, every year we see new AI technologies and services emerge. Alongside those, we see that they make it into our clinical workflows, revenue cycles, and patient and appointment management. The issue is with this increased adoption, we have also seen an increase in avenues for bad actors to access our data, to breach our systems. So these security lapses erode patient and clinician trust, increase regulatory exposure, and executive risk. So we need to make sure that we increase our data security at the same time as we're adding all these new technologies to our workflows. Based on IBM Cost of Data Breach report for 2025, we see that 13% of organizations reported a breach resulting from an attack to their AI systems. Now, 97 of those companies admitted that they didn't really have proper AI access controls and safeguards on place. In particular, here is a major concern when we're talking about shadow AI or unsanctioned AI. So, for example, employees using AI tools to do their jobs. Breaches on those systems account for 7% higher than a sanctioned AI, so at 20% of total breaches. Now, the report estimates that $4.4 million of a global average cost from data breaches, even higher in the United States, that is $10.22 million. Of course, when talking about healthcare, we need to understand that the main target for these attacks is personally identifiable information or personal health information that we contain. So considering that that is the main data that we save, the healthcare industry recorded the highest average breach among all industries at $7.22 million of average cost. Now, considering the type of data that we hold, it makes sense that the healthcare industry records the highest average for breach costs at $7.42 million. And we also take longer to identify these breaches and to close them. Now that we understand the stakes, Ekta, can you tell us what's the real threat, landscape, and governance expectations? And most importantly, why does data security matter?
Absolutely. Thank you, Guillermo, for taking us through the data points. Let us together understand what is at stake from a cost and impact standpoint. Number one is the operational impact. When an AI system is not designed or used ethically, they can fail unpredictably. Example, misclassification and claims processing, which can lead to misallocation of resources, delayed diagnosis, and indirectly or directly impacting the patient health. So ethical AI ensures transparency, fairness, and reliability, reducing overall operational disruptions. The second risk, which is your regulatory risk, healthcare misuse or mishandling of the AI system can cause a major HIPAA violation. Improper handling of PHI through AI tools Non-compliance can lead to fines, litigations, mandated corrective action from the regulators as well. Third, but not the least, reputational is at stake. AI errors, example, biased outcomes or opaque decisions, erode trust among providers, patients, and regulators. Reputational damage is slow and costly, as we all know, costly to repair. Patients and clients expect accountability. Patients and clients expect accountability when AI decisions affect both care and finances. And hence, these three dimensions, which is regulatory, operational, and reputational ethical AI, is not just good to have, it's critical for a sustainable business model. So since we have talked about what is at stake, let me take you through the overall threat landscape for a healthcare organization. So security and privacy threats in machine learning and large language models is a problem. The first pillar, which most of us understands, is the ransomware, which is persistent. It has a it is financially motivated. It disrupts the complete care delivery. Then comes your third-party risk, which is more around your vendor system, your RCM tools, platforms, and how the data is getting exposed to cloud. The third, which is the main pillar for our discussion today, is the AI-specific risk. If I have to just quickly brief around the risk we are talking about, data poisoning. Poisoning, as it says, that somebody manipulating the entire data at the start of it and eroding the overall model itself. Then comes your model inversion, which is again a kind of a privacy attack. Similarly, membership inference. An attacker identifies where a specific data point was a part of the model's training set or no, and can manipulate as in what they want, what outcome they want to be. So prompt injections, especially in the LLM structure, is where the main issue is, and hence an AI-specific risk is the biggest threat when we talk about the ethical AI. So till now, we have understood what is at risk, what are the stakes involved, what are the threats around it. But most of us joining this webinar will be from the healthcare industry. And whosoever knows the healthcare understands HIPAA security rules eventually. So HIPAA security rules are basically the foundation of overall healthcare data protection from an administration, physical, and technical safeguard. And when AI is applied to PHI, these safeguards must extend to the AI systems, not just their overall decision-making models, but also the data pipelines. The second pillar, which is NIST, which is National Institute of Standard and Technology, it governs our three pillars. One is 66R2, which is our second one, and the second one is 53R5. These broadly two talks about vulnerability and the mitigation effect, and the 53R5 talks about comprehensive security controls and cataloging. However, if I take you to the third NIST framework, which is your AI risk management framework, which is basically governed and designed for AI governance. It helps organization map, measure, and manage overall AI risk. Then let me take you through HHS cybersecurity, which is more around performance goals, a set of prioritized practical practices. They encourage organizations to adopt a risk-based layered defense that now must include, and please note, I'm using the word must, it should and must include AI-driven threats and controls. So ethically, AI is not just about good intention. It requires embedding the principles into the regulatory and the standard frameworks. Now, let me take you through how a normal AI data flows and how should we protect it. There are 4 stages. The first stage is data at rest, which could be your EHRs, your data lakes, your model registration. And the risk which is associated is unauthorized access or breaches that can expose the entire data which is there resting in the system. The second is the data which is in transit, which covers your APIs, which APIs calls ETL, ELTs, processes, and model endpoints. The risk of interpretation and manipulation during transfer is a problem at this stage. And hence, Protection ensures secure protocols, integrity checks, monitoring ethically who has the access across and remain confidentiality and trustworthy. The third data flow is data in use, which is where we are working on. It is unique to AI, including prompts, context windows, embedding inference logs. The risk includes inadvertently leakage of sensitive data using AI queries or outputs. Ethical safeguard, minimize exposure, anonymize inputs, and restrict log retentions to avoid misuse. The fourth one, which passes through the entire life cycle from collection, labeling, training, validation, deployment, monitoring, archival, and deletion. Each phase introduces itself to a new risk. Example, maybe an improper data retention. Let me take you through how can we actually do PHI how can we handle PHI information and classification, which currently is non-negotiable. The first one, which is classification. We need to understand how do we identify and categorize the data types on which we are working under PHI, PII, or a PCI information. Each of these has different sensitivity levels and regulatory requirements. So ethical AI begins with knowing what data you are working with, you cannot protect, or what and how that can be managed or classified. The second piece to it is tagging and tracking. Establishing data lineage where the data comes, from where it flows, what are the pipelines, and how it has to be handled, which ensures accountability, traceability. If something goes wrong, like a data breach, you can quickly pinpoint at the root cause. So in AI tracking, ensuring transparency, criticality, both from a compliance and trust standpoint, is very important. The third pillar, which is the segment, it applies data segmentation based on sensitivity. Not all data sets need to be at the same level of sensitivity. An example is anonymized training data set may have a broader use, while a mental health notes will be a restricted, least privileged access. This is where ethics meets practicality, minimizing exposure while maximizing utility. Over to you, Guillermo.
Thank you. Now that we see what we should do and how we should be thinking about compliance, here are some data safeguards that we can actually apply on our businesses. We can look at this from three perspectives. First, what we can do on the technical side, then what we should do with our AI models, and then how we can handle vendor and cloud risks. For the technical side, the main thing that we should always consider is encryption. We must transform any sensitive information that we might have, either in transit or at rest, using strong algorithms approved under the Financial Information Processing Standards or similar initiatives from trusted organizations in your country or in the European Union or similar. Now, as important as encryption is, we need to handle the keys. If we transform all of our data, but we let bad actors acquire our keys, it is the same thing as not having done anything. As such, we need to implement proper key management whenever possible so we can actually benefit from encryption. We can also go deeper into identifying access, privileges, and access, but these are things that in general we should be doing and are simpler to do. Usually your IT teams will already be doing this. Now, besides technical and general techniques that we have mentioned, we also have safeguards for the machine learning applications itself. If you're training in-house models, it is imperative that we only collect whatever data is relevant. So data minimization. We should not be collecting more than necessary, and we should not be keeping it longer than necessary. If we still have PII or PHI fields that should be implemented, then maybe consider using artificial identifiers, so pseudonymization, tokenization, so to replace that data. That way, even if it's breached, our individuals cannot be identified. Now, if we're working with generative AI, so LLMs and similar, especially if we have customer-facing applications, then we should work on filters and protections for prompts and responses. What we tend to see with these applications is that bad actors use the prompt itself, so the model gives them the information that they want, even though if they should. Now, if it is hard to implement these techniques, consider doing red teaming either with your own team or external third-party audits. So red teaming and stress testing your applications, provoking the models to see if they would give in to potential attacks. Now, finally, vendor and cloud risk. Here, what we need to do is first investigate, assess, educate yourself, evaluate your providers. You could be using questionnaires such as the SIG, Standard Information Gathering, or the Consensus Assessment Initiative questionnaires. All of these help you understand if what the service that you're acquiring actually follows standards and such as the HITRUST and HIPAA standards that we want. Then you need to understand what is the level of responsibility for your provider. Not all providers offer the same, and not all providers are doing the same. For example, under the AWS shared responsibility model, AWS themselves protect the infrastructure that runs their services, so the hardware and software. However, if you're using service as a system as a service from their part, you are in charge of handling your own user access, account control, updating the operating systems if you're using virtual machines. So here, what we need to be aware is what are the burdens shared by the provider and what are our burdens. This is also alongside proper contract BA coverage, making sure that both sides understand what is required for each of them. Those are some safeguards for the technical side, but Ekta, can you tell us what safeguards should be wrap our compliance and governance? How should we do it?
Absolutely. So let me take you through the AI data security from a governance standpoint. One, which is the foremost thing, is having policies around it. We need to have approved AI use cases, data lakes and the data sets intake, the prompt and the PHI handling, how we are going to do the retention. So all of these policies are very important. The risk reviews of where we are deploying AI. So DPAI, which is your data protection impact assessment, it is basically coming from GDPR rules and regulations when processing personal data using AI. And the third risk assessment or the risk review which can be done is the threat and the risk assessment, which is broader than DPIA, but it assesses the security risk of the systems and the data. Then comes your model change control, which is nothing but ensuring that the AI models are systematic and traceable. The versioning, the documentation, testing, validation before deployment is very important. And of course, the approval of the workflows is another important piece to it. Human oversight, the complete RACI around us, who is responsible, who is accountable for that model ownership, security, compliance, and technical safety. Then yes, very important, the auditable trails. The lineage, the consents, the access prompts, the outputs, and the overrides. All of this becomes very important under the governance. Then let me take you through the privacy by design in AI workflows. Having the consent and the notices for AI-assisted processing when required. Use limitation, ban shadow AI. So shadow AI is nothing but without approvals if something is deployed into the system. Please ban that. Route to the approved endpoints. De-identification, standardization, and expert determination wherever used. And yes, output safeguarding is very important. Block listing, watermarking, and response truncation of the PHI is equally important under privacy laws. So Guillermo, help us how this will translate into resilience and trust.
Of course. Now, if we take everything that we said into consideration, here's a 9-step action plan, about a 90-day sprint on things that we can do. First, audit AI use cases and data flows. So prompt logs. If you have AI, you need to be on top of it. Don't let it just sit. You need to constantly audit and make sure everything is going correctly. Then classify datasets, tag PIH and PIA, set policies, as we mentioned before, identify sensitive information, and properly handle it. Then enforce single sign-on, multi-factor authentication, least privilege, any management technique that you want to control access to your systems. Encrypt data at rest and in transit, centralized key management. Again, use encryption and make sure you are actually protecting your encryption by handling your keys. There are many systems that allow you to do this. Then classify stand-up AI security gateway, prompt response, tag PHI. So again, work on AI and how you are handling your sensitive information inside of that system. 6, lock down vendor access, validate your business accounts and controls. Then implement immutable backups for EHR and AI artifacts. Make mandatory login monitoring with PHI safe retention. This one in particular, very important. Mandatory, not a suggestion. And then finally, conduct tabletop incidents and use breach notifications with AI scenarios. In general, just take a look at your systems and make sure you're following standard practices. Nothing here is particularly new for AI, just the things that we should already be doing applied to AI.
Okay, great roadmap, Guillermo. And thank you, Ekta, for those insights. Let's open it up for questions from the audience. So we have 2 questions. The first one is, what is the single most common mistake you see healthcare organizations make when securing AI systems, and how can we avoid it?
Well, I can handle this. First one is ignoring, as we mentioned, shadow AI. When handling AI systems, what we need to remember is that we also need to handle unsanctioned systems. It is very common now to see in companies people using AI to help with their tasks, and if these are not tools that we have already vetted and applied all of our safeguards to, we're in incredible risk. Now, when it's come to actual sanctioned AI, the most recent trend being LLMs, we need to understand that what is prompt protection and how we are protecting ourselves from possible injections into our system using prompts and what we are responding. Thank you.
Okay. All right. All right. The second one goes, and I think this one would be for you, Ekta. If we do not have a large compliance or security team, what is the first safeguard that you would recommend that organizations prioritize in the first 90 days of implementation?
Okay. We did cover in bits and pieces when we talked about our 9 action plan, but to start with, the data access controls and logging is very important. Even without a large team, you can make a big impact by just restricting with the access. Whosoever needs us will get it. Even not just the data, but also the models. Logging all interactions with AI system, especially the LLMs, reviewing prompts and the outputs for potential leakages or misuses. I think with these 3 steps will help you detect and even respond to the risk early on. And they can lay foundation for more advanced safeguards as your team grows. I just want to give a thought here that in healthcare, AI without ethics is a risk, but with ethics, it's a revolution. Thank you.
All right. Thank you guys for those insights. So as we wrap up the session for today, let's quickly recap the key takeaways. Healthcare organizations face unique risk as AI adoption accelerates from ransomware and vendor vulnerabilities to AI-specific threats. Safeguards like encryption, access controls, and secure data pipelines are essential. but they only work when paired with the strong governance and privacy by design practices. Thank you, Guillermo and Ekta, for being with us today. I think our call to action is simple for our audience. Take these insights back to your organizations and put them into practice. And please do not forget to register for the next CCD webinar, where we will continue exploring how to adopt AI responsibly in healthcare environments. We will also be circulating the invitation for our October RVMA webinar, along with today's recording. To all of our attendees. So a big thank you to Ekta and Guillermo again for sharing their expertise. And thank you to all of you for joining us today. We look forward to continue the conversation on AI. Thank you, guys.